Great. So thanks everyone for sticking around till the last presentation of the day. I kind of wish this presentation came directly after John's yesterday, and especially Jason's discussion, because this is kind of one of those situations where if you want to know the answer to a question, maybe the best thing to do is pick up the phone and call someone and ask, right? So that's basically what we've done in this paper is we've surveyed a bunch of retirees, and we've asked them, why they made the Social Security claiming choices and the DB pension payout choices that they actually made. So I'll start with a little bit of motivation. So first, most people when they approach retirement have multiple sources of retirement wealth. So that might include some combination of Social Security, defined benefit pensions, defined contribution accounts. And so a key question that faces retirees in this situation is how best to draw down on that retirement wealth. And in many cases, this boils down to a question of whether you annuitize or not. Right, so DB pensions frequently offer the choice of a lump sum payout versus an annuity. The decision of when to claim Social Security can also be viewed as a decision of how to what extent to annuitize, because when you delay Social Security, you are effectively buying an annuity. You're sacrificing higher payments now, or you're sacrificing the benefit that you receive now in exchange for higher payments for the rest of your life. And as you know, in many cases, this is also a joint annuity that continues for the rest of your spouse's life as well. And I'm not going to sort of repeat the information that John provided yesterday, but just to summarize, it turns out that delaying Social Security is a very good deal for primary earners who are married. It's a pretty good deal for singles. It's a little bit more questionable for secondary earners. So, why don't people delay Social Security? Couple of alternatives. So it could be that they're liquidity constrained. They don't have the wealth to finance the delay. As John suggested yesterday in sort of our other paper, that's not the case for many people. It also turns out that people have a reasonable understanding of Social Security's rules. If you kind of ask them by what percent do your monthly benefits increase for each year of delay, people tend to get answers that are kind of around the right value. So this is kind of a broader question of this. All of this kind of falls into a broader question of why do people fail to annuitize their wealth, right? And with Social Security, they're failing to annuitize even though the annuities are sold on actuarially advantageous terms for many people. And with DBs, when people make an annuity versus a lump sum choice, it turns out the lump sums are often actuarially disadvantageous, but people frequently take them anyway. Although in some situations it might actually be a good thing to do to use the lump sum to delay Social Security, but I won't get too much into that. So basically what we do here is present survey-based evidence on why people claim Social Security early and why they make the DB payout choices that they made. And we don't think, we basically ask people their reasons for making the decisions that they made. And, we don't think this provides definitive answers to the question of why they make the choices that they made, because, people might be, rationalizing ex post a decision that they made, 5 years ago. But we think they provide hypotheses that we can explore. So tell you a little bit about our survey. So we collaborated with Towers Watson, a benefits consulting firm. And Towers Watson had been administering a panel. They've basically been doing a series of surveys. They had been surveying a panel of retirees who received services through their health insurance exchange for retiree health insurance. And so, it started out with an onboarding survey that asked general questions, and then there are a couple of other surveys about living arrangements, work history, attitudes towards retirement, and their financial situation. And so in this particular survey, so John and David and I collaborated with some folks at Towers Watson to basically design these questions that went out to this same panel of retirees. And we received responses from 2,620 respondents. And now, obviously, the people who participate in Towers-Watson's health insurance exchange are not a representative sample of retirees. We're not getting a nationally representative sample. For example, all of the people in this group are receiving some kind of retiree health insurance, which is not the norm for the average worker. Most of them are covered by defined benefit pensions, but we still think the survey provides us with some useful information about how an important subset of the population approaches Social Security and DB payout choices. So the survey consisted of two parts, right? So part one, we asked people about Social Security claiming. And the first thing we did was we asked people what year they were born in. And we used this information to exclude people who were born in 1954 or later because they haven't yet reached age 62, so they haven't yet made a decision of when to claim worker benefits. So this is the distribution of birth years of people in our sample. Very few people were born in 1954 or later. So if we end up with a sample of 2,608 people after we exclude these individuals. Of the people in our sample, most of them have a normal retirement age of either 65 or somewhere between 65 and 66. A few have a normal retirement age of 66. And for people who have claimed Social Security in this group, we asked them why they claimed when they did. If there was a gap between when they stopped working and when they claimed, we asked them how they financed the delay period. And then we asked a subset of these people who received particularly generous delayed retirement credits how familiar they were with the rules governing delay. And people who had not claimed yet, we asked them when they planned to claim and why. So I think this I sort of went through already. So we focus on people born after 1954. Most have an NRA of 65 or somewhere between 65 and 66. And so those are kind of the questions that we ask people. The first question that we ask people is, so are you currently collecting Social Security benefits? The vast majority of our sample has claimed. Right, so they are collecting some kind of Social Security benefits. And we asked them when they started receiving Social Security. So there's a wide range of claiming ages here. You do see a spike at 62 and kind of at 65 or 66. You also see ages going all the way down to the 20s and 30s. That's because these are probably disability benefits. We do ask them, the next question is, what type of benefit do you receive? You see a spike at 60, that's likely the survivor benefits, small spike. So we asked them next, what type of benefit do you receive? The vast majority receive retired worker benefits. A smaller fraction receive disability, spousal, or survivor benefits. We also asked them, what's your relationship status? About 75% are married. The rest are either never married, divorced, separated, or widowed. Among those who are married, we asked them how their earnings compared to their spouse's earnings over their career. And the point of this question was to try to identify primary earners. So these are the ones who get the biggest delays, the biggest gains from delaying Social Security. The vast majority of married people, so about 83%, are actually the primary earner in the couple. We asked them their current employment status. About 86% are they're not working and not looking for work. So we would call that retired. 7.7% are working part-time. Very few are actually working full-time or would call themselves unemployed. Of those who are not currently working, almost 92% have worked in the past. And this is the distribution of retirement ages for people who are currently not working. So this is, when did you last work? So again, we kind of see a spike at 62, another spike at 65, but they're kind of, you do see some significantly lower retirement ages as well. So we decided to restrict the sample to people who retired after the age of 50, who are claiming retired worker benefits, who started receiving Social Security at 62 or later, because it's possible that people started receiving disability benefits earlier in their life and then switched to retirement benefits at their normal retirement age, and we want to exclude those people because the claiming decision they're making is a little bit different. And we also restrict attention to people who are either single or the primary earner in the married couple. So these are the people who get the biggest gains from delay. It excludes secondary earners who, the gains from delay are substantially lower for this group. So this is the distribution of claiming ages for our restricted sample. This is 1,802 individuals. Again, big spike at 62, smaller spikes at 65 and 66, representing normal retirement age. Very few people delay beyond that. So this is basically a summary. About 2/3 of the sample, 67%, claim before normal retirement age, 23.5% claim at normal retirement age, and 9.2% claim after normal retirement age. So again, a very small fraction of people delay. This is the distribution of retirement ages, again, for that restricted sample of people who work to at least 50, are taking a retired worker benefit, and either a single person or a primary earner who claimed at 62 or later. And we also calculated the difference between each person's retirement age and their claiming age. And this is, again, for the restricted sample. So what you see, that big spike there, is these are the people who claimed right when they retired. Right? And we talked about a little bit yesterday about this idea that claiming and retirement are kind of married in people's minds. If you look at some of the stuff the Social Security Administration, some of the language they use to describe the retired worker program, they use claiming and retirement interchangeably. So it's possible that these decisions occur simultaneously for many people, because they think they're supposed to claim when they stop working. We asked people who had claimed how satisfied they were with their claiming decision. In particular, we asked them to rate their agreement with a series of statements. So if you look at the first question, I'm very satisfied with my decision on when to start my Social Security benefits. The majority of people say either agree or strongly agree with that. There's a little bit more agreement among people who claimed at or after NRA compared to people who claimed before NRA. Second question was, if I were to do it over, I would have delayed starting Social Security until a later age. A number of people who claimed before NRA do actually agree that they would have delayed. But then if you look at the next questions, if I were to do it over, I would have lived off my other retirement saving after stopping work and before claiming, or I would have worked longer. Very few people indicate an agreement that they would have been willing to draw down on other savings or work longer in order to delay. We then asked people their reasons for claiming Social Security when they did. And if you look at the people who claimed before NRA, the two most common reasons that were provided, the first one is we needed the money. Second most popular response is, I had stopped working and assumed that one should commence Social Security benefits as soon as possible after stopping working. Right? So this is the idea that claiming and retirement are kind of married in people's minds. And then the third most popular response was we thought we could invest the money and end up ahead. Okay, so this desire to maybe beat the market and kind of invest the money. Very few people say that they were encouraged to claim by an employee at the Social Security office, and about 10% felt their health wasn't good enough and they were worried about how long they would live. We asked people how much time elapsed between the time you stopped working and the time you claimed. For a lot of people, there actually was a gap of 24 months or more, especially those who claimed before NRA. That's possible that, these are people who stopped working in their 50s and they had to wait till 62 to claim. So we asked these people who had a gap between the time they stopped working and the time that they claimed how they financed the delay. Large number of people say they used their savings. Smaller fractions say they used their spouse's income or relied, nobody among the early claimers say they relied on help from family and friends. Very few took out a loan. A lot of people gave an other reason, and we did allow a text response for other. And a common text response there was they relied on an employer pension in the meantime. So the next thing we did is we decided to focus on people who were born in 1943 or later. So these are the people who get a delayed retirement credit of 8%. Right? So people who were born before that got a less generous delayed retirement credit. And we asked this group of people how familiar they were with with the fact that Social Security benefits increase by about 8% for each year that you delay, starting between 62 and 70. Most people indicate familiarity with that rule. Even early claimers, people who claim at normal retirement age, people who claim after. We also asked them how familiar they were with the rule that widow and widower benefits are based on the higher of the two benefits. Right, so that's a big part of the source of the gains from delay for primary earners. Again, the vast majority were, familiar or very familiar with that rule. We asked this group, if you were contemplating retirement today, would you be more likely to wait to start Social Security? Most people say they would make the same decision. Almost 28% of the people who claimed early, though, say they would delay as long as they could if they were to do it over. Part 2 of the survey focuses on defined benefit payout choices. And so here we focus on individuals who say that they are retired from an employer, so that's 2,381 people. And we asked this group of individuals about their DB coverage and their payout options that they were offered when they retired from that employer. And we also asked them, those who had choice, we asked them about the approximate lump sum and annuity amounts. For those who chose the lump sum over the annuity, we asked them why they did it. So what was their motivation in choosing the lump sum? So we first found that about 76% of our sample had a defined benefit pension. 38.4% had a defined contribution. Some were not sure which type. So again, this shows this is not a nationally representative population. The vast majority of them have a DB pension. And then we asked them what choices they were offered. The vast majority were offered some kind of annuity, which is not surprising. Only about 21% were offered a lump sum at all. So this is kind of a small sample that we were working with. People who were offered the lump sum, we asked them to kind of estimate how big was the lump sum you were offered. Most of them are not small. They're sort of decent size. A lot of them are above $100,000. We also asked them to estimate the size of the annuity. And we asked them, which annuity are you estimating the size of? And so that's kind of the distribution of the annuity amounts. Of those who had a choice between an annuity and a lump sum, 35% took the lump sum, another 8.1% took some of the money as a lump sum and another part as a monthly benefit. The majority actually took the monthly benefit for the rest of their life, which is a little bit inconsistent with some of the previous research on this, which suggests some large numbers of people taking the lump sum. It's possible that, we're looking at specific people who retired from specific firms. There could be something special about those firms and the kinds of deals that they were offering. We have not sort of dug further into that. We asked people who took the lump sum, what did you do with that lump sum benefit? Vast majority rolled it into an IRA. Very few people actually used it to finance consumption. We asked people about the extent to which they agree or disagree with various statements about why they chose the lump sum. Most people, or a large number of people, say that they considered the present value of the lump sum versus the value of the lifetime benefits. So they are kind of making an actuarial calculation. Some people chose the lump sum because their financial advisor suggested it. Not too many people say, actually very few people say that they needed the money to pay off existing bills and debts. Very few people also said they didn't trust the provider of the annuity to offer a fair deal. And some people, still a minority of people say that they were afraid that they might die before getting back the value of the lump sum that they gave up. So to kind of summarize, main motivations people give for claiming Social Security early, they need the money. And as John suggested in our other work, there is a sizable fraction of people who have enough money to delay Social Security by 2 to 4 years. So these could be the people who don't. It could be that among people who do, they are saving that money as precautionary savings. So those are some possibilities. Another major motivation for claiming early is the assumption that claiming should occur right when you stop work. A third key motivation is the desire to invest the money and come out ahead. Majority of the people indicate that they are familiar with the Social Security provisions that make delay attractive. In terms of motivations for choosing a lump sum over an annuity, the main one is a perception of actuarial fairness. I mean, people, did some kind of calculation and some kind of comparison and thought about the value of these two things, and possibly a desire to invest, which we see in the fact that a large number of people rolled their lump sum over into an IRA. So further steps, this is very preliminary work. I mean, we just got the data back from this survey, so these are really just the very first tabulations that we have done with this. So the next steps, we have these other surveys in this series that we can merge this survey with, so we can kind of examine the relationship between other characteristics like health and work history and the demographic information that we have and the wealth drawdown behavior that we're seeing in this survey. And then we can also look a little bit more. We ask people to estimate the size of the lump sum and the annuities to kind of look at how generous are these lump sums relative to the annuities, and do we see any relationship there between that and kind of the choices that people make.
Okay. So I'm very pleased to have the opportunity to discuss this paper by two of my close friends. It's very preliminary, as you saw, and so I think that mostly what I'm going to try to do is give them some ideas of things that they might do next with the data. They use this to investigate reasons behind the timing of Social Security claiming and the decision between lump sum and annuity payouts for DB pensions. And this is, as I said, preliminary and a very early glimpse at the data. So most of what we saw today was just bivariate analysis, which means that there's a lot of ideas that we could all come up with about what they could do next. But a few small suggestions might be helpful to test whether some of these differences are significant. And since it is such a selected sample, to think about how it actually compares and provide some comparisons to the HRS, for example. I think it would be nice to look at those things that are coded in other and try to categorize them together so that you can take advantage of that. In a lot of the tables, they looked at the timing of claiming, and I thought it might be helpful to separate out people who claimed at 62 versus people who claimed between 62 and the normal retirement age, especially in this case here, where even in the text you talk about the fact that the delay between when people claimed and when they retired might in part be due to not being able to claim when you actually retired. So they find that familiarity with the benefits of delay and the benefits of claiming is related to people who delayed more. But I think one concern there is that perhaps they learned about it precisely because they delayed. And that is sort of the major weakness of this kind of research. Not that I think that it's not worth pursuing, but of course we're asking people about their knowledge and their experiences today with regards to decisions that they made in the past. So one thing I think that might be particularly a problem for is thinking about whether or not people wish they had delayed claiming or how satisfied they were with their decision. So imagine that you claimed very early because you thought you weren't going to live very long, but now here it is 20 years later, you're 82, and you didn't think you were going to live that long, so now you regret the decision you made in the past. And I think an easy way to deal with that problem would just be to focus more of your analysis on this group of people who were born after 1943, which you already do for many of the results anyway. This is sort of what I've said before, but I think it does give us some great insight into why people retired and claimed when they did. But since it is measured after retirement, I think a good idea might be to focus on some of the outcomes. So a few possible ideas to think about in the future. So I did look through some of the other surveys that are connected to this, and I think one would be to look at whether or not satisfaction with the timing of claiming relates to the reason given for the timing of claiming, how that relates to their health, and then to look at whether or not people who claimed early are more likely to report health problems now or lower life satisfaction, or I noticed in one of the surveys a question about satisfaction with the financial situation. That one seems particularly potentially fruitful. So since it is the very last talk of the day, I thought I would keep my comments very short. So thank you.
Hi, knowing Towers Watson, I may know the answer to this question, but do you have any public sector workers in your sample?
I don't know. I mean, Towers Watson might be able to answer that question for us.
Towers Watson doesn't do much work with the public sector.
I don't think so, though.
The reason I would ask is because the lump sum decision is much different for public sector workers. Because the lump sum in the private sector is usually you take the discounted value of the pension and you convert it to a lump sum and you offer that under certain circumstances. In the public sector, the lump sum option is typically the accumulated value of the employee's contribution with interest, which means it may very well be true that the lump sum vastly exceeds the present value of the pension benefit if the person is earlier in retiring earlier. So if you haven't accounted for that, I would say you ought to check and make sure you know the answer to do you have public sector workers.
Yeah, no, that's a good question. Thanks.
So I probably shouldn't have any questions about this paper, but I have one. No, actually, it's not quite a question. I was just thinking, because I think at lunch and yesterday we were talking about conflicted advice, presumably if you take the annuity from your employer, the financial advisor doesn't make any basis points on that money. But if you take a lump sum, then it becomes into the IRA or the investable pool on which the financial advisor does get money. So, I mean, maybe they're above this, but there is a conflict in the financial advisor's advice that they get money if you take the lump sum and they don't if you decline the lump sum. I think that's right. So that may be another example of conflicted advice.
Yeah, and I think you might see some of that in the Social Security claiming as well, right? If you claim Social Security, if you delay Social Security and use the money in your IRA to finance that, then that might be. And if you look at kind of the text other responses for, why did you claim Social Security when you did, I haven't gotten around to coding those up yet, but there is, you do see a number of responses that say if a financial advisor suggested that I claim Social Security early.
So John, let me agree with you. I think that's a situation where there is a high potential for conflicted advice. And What I wanted to say is similar to what I said yesterday. Yesterday, I was saying that if you are going to take Social Security early because you think you can invest it and do better, you have to be all in on stocks, otherwise you don't even have a chance. It's the same with taking a lump sum from a pension plan and thinking you can do better, you got to go all in on stocks. Otherwise, if you're just going to invest in bonds, you don't even have a chance. And this gets now to potential for conflicted advice, is that I think if an advisor tells someone, take the lump sum, and then they invest in bonds, I mean, there's just a clear example of, and then they have assets under management charge, there's a clear example of giving poor advice and benefiting them by that poor advice. And I like to get this information out so at least we can see what are the circumstances under which you even have a chance to do better by taking the lump sum. The other comment I wanted to make, just to have fun with this, I think people don't really think things through when they say they took a lump sum because they didn't think they would live. You know, they were worried about dying before getting all their money. So the response is, well, you're dead. You know, are you really worried up in heaven, worried about that you shouldn't take that monthly benefit? But on the other hand, I do know I can imagine what it feels like to live a long time and be poor. That's the risk we should focus people on, is living a long time and being poor rather than dying and regretting that you took that monthly benefit. So I think we need to start thinking about how we frame things to people and make better decisions.
Were you able to find, I think some of the earlier research on the DB cash out found that very high rates, but it was concentrated in really, there's this long tail of very, very small cash out, DB values from, terminated employees from.
Yeah.
Did you find that the bigger the DB pension, the less likely they were to cash out?
We haven't done that calculation. We haven't looked at
Looked like
that yet.
there was
But
data there.
yeah. So we could potentially do that, and I think that would be worth doing. Yeah, because you're right. There are a number of these sort of small.
Because I think in the when you adjusted for size, it wasn't nearly as high of a cash out rate for sizable pensions, and it might be somewhat consistent with what you have.
It's not even clear to me that if you have a small pension, that you should do something other than cash out. I mean, maybe it's your one chance to have $50,000 or $20,000 to go on that lifelong dream vacation that you never got to take, because
Lifelong dream to delay Social Security. 1 year. That's the next one. Pretty exciting. Other questions?
Matthew Shapiro. So I'm coming back to this tax question, and I'm wondering if another thing people are confused about is the income tax implication for inherited IRAs. So do people understand that the kids who inherit the IRA have to pay the income tax? And this might not be as big a after-tax nest egg. That would be one reason for wanting a nest egg, and a thing I can imagine people are confused about, and a thing which your survey might tell us.
I'd like to ask one, please. So, did you any evidence in your responses about Social Security decision about the financial worry about the financial status of the system itself? Social Security is not going to be there anymore, or the same loss aversion.
I've not looked at every single one of the responses. I've just kind of scanned them.
But
I didn't see anything like that.
But there was the opportunity to answer that.
Yeah, so they could have put that as their text response. We gave them a list of responses, and those were the ones that were up on the screen. And then they had the option of choosing other and just kind of typing in a response. And I didn't see that. That doesn't mean it's not it's not there. I'd have to look more.
It's just an anecdotal,
Yeah.
some surveys have found that. And
The one thing we have done, and this was actually in the other paper that John presented, but I don't think he discussed that result here, is we looked in the HRS at the correlation between people who think there's a high probability of Social Security benefits being cut in the next 10 years and the age at which they claimed. We didn't really find anything there, but that's kind of all we've done with that.
Thank you.
Thank you very much. Oh, I do have a mic right here, but anyway, I wanted to thank you all for coming. I want to thank Kathleen. I wanted to tell you that we're extremely likely to do this again next year. It will probably be the same week, in other words, whatever it is, the second Thursday and Friday in October. We'll celebrate Bob's birthday again. So obviously, if you know of papers, you have papers. I can't promise. I want to kind of have a good portfolio of papers, so I can't promise that your paper will be included. But because I do like to kind of fit them together. I thought these fit together very well, and they don't have to be Sloan-supported papers. Maybe 2/3 of these were, and that's a good source for me to look at the grants and find the papers, but it doesn't have to be. So that's it. Have a great year. If this is the only time of year I see you. Okay, take care.